everyone. So you know that burnout is real, right? Burnout is real, you know. Burnout is so real. Sometimes I feel as though I'm going through it. Honestly, that's how I feel some days. I love my job, not necessarily my job. I love what I do as a nurse, but some days I just feel overwhelmed with the amount of things that I'm supposed to be doing. I'm not scared of work. I'm not that kind of person. A lot of times it is because of the fact that this thing was recording me. All right, so a lot of times you hear people talk about, you know, they're quitting their job and it is because of this reason, that reason. And there's so many different reasons people talk about why they don't want to continue in their path, you know, in their career. Because they're looking for something different. They're looking for something different because of that. And for me right now, I'm 1 year in as a nurse practitioner and I'm feeling that way as well. I'm feeling that way as well because a lot of times I'll get up, I'll go, and I am ready to see my patients and everything, you know, will go well throughout the day. But then it feels as though I'm not getting any more satisfaction. I did a video the other day. I haven't posted it as yet, but I'm going to do it as a 2-part video because it's a little bit long. I'll probably even do it as 3 or 4 pieces because it's almost 55 minutes. But after I'm finished editing, I'll see how much minutes it is. But I want persons to kind of just listen to it. But it's about my experience, you know, working as a nurse practitioner, and it's only 1 year in. So I definitely will upload it so persons can have the long form of it as well as the short form of it in the event that you have persons with short attention span. But nevertheless, yeah, a lot of times I'm feeling as though I'm at the end of my career in nursing. And that is just so, you know, I'm not supposed to be saying that. I'm not supposed to be saying that. I encourage people to go in the field of nursing because it is a lovely profession. But at the end of the day as well, like sometimes I'm not feeling any satisfaction since of lately. And that is since I started working as a nurse practitioner. I don't know if I probably need to go in something else apart from house call service and see what is out there. I know probably if I go into cardiology, I'll definitely enjoy it, and renal or nephrology, because those areas are areas that I always have an interest in. But you know, when job kind of come at you, you always run with the first one. So the first opportunity I get as a nurse practitioner was a house call service. And as I say, house call service, my take on it is that it is a very good service that we're offering to our patients at home. But experiencing it, yes, it's totally different from what I was expecting. I think nowadays, most people are more into making money and they're not focusing on the patient. And that's just what I am thinking. That's just how I'm feeling based on what I am seeing, you know, the service that I am offering to the patients. But yes, a lot of persons tend to feel as though they're at, you know, a point where they want to quit their job. And it is because of multiple things. It can be financial issues. It can be a case where they're just feeling burnt out. You understand? So I'm going to talk about a few other things that contributing to why nurses are quitting their job so much, especially in the hospital setting. And I don't know in the house call setting or as a nurse practitioner if that is a thing, but I'm gonna talk about the hospital setting because I know when I was working in the hospital setting, there were so many things that, you know, we struggle with as nurses on a daily basis, and we just have to kind of go at it because it is our only means of making money and making sure that our expenses at the end of the day is being met. So if you haven't subscribed as yet though, I would love for you to go ahead and subscribe to the channel, like, share, comment, turn your notification bell on, and just, you know, leave your 2 cents with me as well. Yeah, just leave a few comments as well on the video. I would do appreciate that. A thumbs up, a like, and a share. All right, so the first thing is that a lot of persons are experiencing burnout and they feel as though they're overworked. And I can tell you that is something that ever since I started working in the US here, that's just how I feel, because it was more of, you know, you just have to be constantly going at it because the hospitals are more focused on, let's just say, money. Yeah, I'm just gonna say they're more focused on money versus the health of the patient, you know, the overall aspect of the patient. And so a lot of times you might find out that it is very time sensitive with certain things, you know, getting the patients in and out and making sure you're meeting all of those markers and doing the correct activation. So at the end of the day, yes, they look out for the patient, but I think it's more, you know, all about the money. And nothing is wrong with that, but what I would have appreciated is that we would find the time to make sure that we're spending the time to see the patients, evaluate them appropriately, and not feeling as though the nurses are being rushed into getting things done without even thinking about, you know, critically thinking about what they're doing or making sure that the patient is comfortable with certain things that we're offering them. So while we need to be ensuring that patient safety is key, I think a lot of times sometimes we are so focused on, just making sure those patients come in and they go out in a timely manner, and we're not focusing on the fact that the nurses that are doing all of these jobs are so overworked or tired. So we need to kind of just focus a little bit more on the staff as well, so that way they're not feeling as though they're constantly running around in the departments feeling overworked and tired. Another thing that, the other thing that has been contributing to a lot of that is the long hours. And yes, the 12-hour shifts are fine for some persons. It's not for some persons, but definitely the 12-hour shifts are very long. And so that sometimes do contribute to a lot of persons feeling tired, overworked and exhausted. And just imagine if you are on a floor that definitely doesn't have enough staff and you are the only person with another colleague or two, then you're probably gonna have to be picking up extra shifts. I'm not saying that it is always mandatory, but they're always going to be relying on you, and so that is also one thing that contributes to persons feeling overwhelmed and tired. And especially since the COVID pandemic, that has caused persons to feel emotionally drained. They have been at a point where it's like they were so overworked, tired, and then it hit them emotionally as well. And so all of that is just contributing to the overall exhaustion that persons are facing now in their job, and the burnout and just feeling overworked in general. All right, another thing is that when it comes on to patient ratio, a lot of people feel as though the staffing ratio is unfair, and I can talk about that because I remember when I just started working as a nurse here in the state, I felt as though I was getting all of the sickest patients in the department as an international nurse. I'm not lying. The patients that I normally would be getting are the sickest patients in the department, and while you look at your other colleagues, you'll realize that their patient's acuity is not that bad. Their patient acuity is not that bad. And so sometimes I just feel as though the ratio, while yes, if the ratio is 4-to-1, nothing is wrong with that, but when it comes on to 4-to-1, just make sure that the acuity, the severity, how sick the patients are is easily distributed to different nurses. You can't have one nurse having like 3 really ill patients while another nurse has 4 patients that are walking about, and the amount of work that you need to do for those patients are limited. So we need to not only look at the patient ratio, but we also need to look at the acuity of the patient. How bad is the patient? How sick is the patient? So that way we can always say, all right, this nurse might have 2 patients, but the 2 patients are stroke patients who are bedridden or bedbound and not able to do anything, and you have neuro checks and all of those things to do, versus another nurse who has 3 patients that are walkie-talkie. There are priority 4 are non-emergent cases. Then that nurse probably could get a 4th patient to go ahead and take care of in the meantime. So all of that is something that a lot of persons, especially when it comes down to the international nurses, because when you just come to America, you feel as though sometimes you don't really have that much say, or you're timid to say things. If you're not the kind of person that is very outspoken, then you will be one of those persons who tend to get a lot of high acuity patients and then feeling tired or excessively tired at the end of the shift. Another thing that a lot of times you hear people talking about is the fact that they don't get the respect and the support that they need when it comes on to being a nurse. And so a lot of times persons tend to want to not continue in that journey, because yes, while we're taking care of sick patients, I tell you, some of the sickest patients are the rudest patients you can ever imagine. Sometimes they don't really show any appreciation. They don't understand that they're the ones that are on the bed that is sick. You understand? It seems as though you, the nurse who's taking care of the patients, are the ones that are asking or in need of assistance at that time. When it comes on to us as nurses taking care of persons, regardless of our color or race, respect is due at all times. And I think that is where a lot of times persons are feeling frustrated, especially for international persons or persons from a different culture. You find them coming here and they're working, they're doing their best, and regardless of how you're doing it, sometimes the response that you get from the patients as well as the family members, it is so unbecoming. You understand? It is so unbecoming, because a lot of times it's like you're not doing anything for them. And then when you look at it, yes, you're not really comparing, but deep down when you see some other persons that are doing some job or some duty as a nurse, but deep down when you look at it and you realize that some other nurse is doing something that probably you could have just said, okay then, yeah, and you just continue on the merry way, you realize that those persons are the ones that are getting the Daisy Award while you are over there doing everything for your patient, and you're thinking that you are doing such an excellent job, and only to find out that the response that the patient or the relative is giving you is not even saying thank you or they do appreciate you. And so because of that, a lot of persons are not really wanting to continue in the area because they're just feeling as though they're losing the respect. Nobody appreciates you for what you're doing. And then the other part to it is that, when it comes on to you getting the support from your colleagues or from your boss, your employers, sometimes it's not there because especially, they always say that the patient is always right. And we can understand that to some extent, but if you're going to always look at the patient and say that they're always right and not looking at what your colleagues, you're not looking at what the staff is saying, you don't really find a lot of persons wanting to hang out with that company or the employer that they're with because they don't feel as though they have the support. Because a lot of times I've seen where nurses are in the right, and in order to protect the brand, you always have to smile and always have to say things in order for the patient and their relatives to feel happy and feel as though you're giving them the best care. And then in turn, the patient's nurse is the one that is, feeling as though what she did was wrong, when really and truly she never really did anything. So because your employer, your boss, your manager, they want to get a good score on certain things that they're being evaluated for, you're always going to make the patient happy. And as I say, nothing is wrong with making the patient happy, but at the same time we need to be open-minded and remember that without your staff, without your nurses available, you won't have those patients to give you those good results. All right, the staff or the nurses feel as though they're undervalued by the doctors, management, leadership, as well as the patients. And so a lot of persons find it demoralizing because of all of that. So, travel nursing is something that is very big, and a lot of persons are making a lot of money when it comes on to travel nursing. So a lot of persons are feeling like they're not paid well in comparison to the amount of work that they have. You understand? So they complain about the low pay and the workload. And yes, travel nurses do make a lot of money, but at the end of the day, they don't really get a lot of benefits through the company that they're with. But some nurses will look at it to say, even though they're full-time nurses and they do getting compensation packages, which includes like tuition reimbursement, insurances and all of those things, 401k, that a lot of travel nurses don't have access to through the company. Yes, their rate might be a little bit lower because of all of those benefits that they get as full-time staff with the company. But some persons still do complain about it because they're looking at it to say that if a company or if your employer is able to go ahead and be paying, like say for example $100 to travel nurses to come and do the same job that the full-time nurses are available to do, could have done the job as well if they were being paid an extra $5 or $10, because what they're paying travel nurses to come and do the job is something that they can do as a full-time nurse. All right. Another thing is that you have a lot of persons who have been dealing with, different mental health issues. But yes, it might not be something that a lot of persons are talking about, but just imagine you constantly always seeing persons dying, or really sick or involved in some form of trauma. Then you realize that over time, it either makes you a little bit bitter, or some persons, it causes them to feel as though they're depressed all the time. And so that is one reason why a lot of persons are wanting to leave the profession and quit. And as I talk about that, remember COVID at the time, a lot of persons were seeing like dead bodies all over in hospitals, just laying down, and it was just not, it was just not something that a lot of persons enjoyed watching because, from their standpoint, they should be preparing or doing better for those patients. It was something that a lot of persons couldn't handle, and emotionally persons were dealing with that. And so some persons develop like post-traumatic stress disorder from that. You have a lot of persons who are just struggling with the whole thing, the anxiety that comes with it. Some persons are taking medications because of it. So a lot of persons are wanting to leave because of the high trauma, the stress that comes with it, the emotional toll that is taking over their body, and they just can't cope with it anymore. When it comes on to being a nurse, it is a job that usually is very high stress. Let's just say that, regardless of the department that you're working in. And so a lot of persons are moving outside of bedside nursing because they want something better. They're looking for better career opportunities. And so some persons are looking into like telehealth, which is not much hands-on and it is not stressful, and at the end of the day they don't have to get in contact with a lot of patients, which is going to cause any problems with administrators or doctors or anything like that. that. And so a lot of persons are just trying to find low stressed environment to continue with their career. Some persons are looking outside of nursing as well to continue. Some persons are going into travel nursing because, you know, they want more money, or they want the flexibility to travel to different places and not feeling obligated to any company. And so you find out that this is one other reason why persons are quitting their job, because of better opportunities out there. Another thing that a lot of persons will realize in the nursing profession is when it comes on to the toxicity. You know, when it comes on to toxicity, it is very common in the nursing profession. And I've been to a lot of hospitals before, and it is something that you can see. It is so awful in the health industry here. You don't even understand it. You don't even understand it. And when you're an international nurse and you come here working, you will realize that you find out that there's a lot of favoritism. There is always different cliques, you know, different groups who not talking to the other, you know, a lot of micromanagement, and there is so much bullying when it comes on to the nursing profession. And that is another topic for another day. But there is so much bullying that is happening in the workplace that a lot of times, you know, persons are not talking about, and that makes a lot of staff unhappy. So as you go along, you will realize that all of these things are contributing to why a lot of persons are not wanting to continue in their job, because they can't deal with the bullying, the micromanagement, you know, the favoritism. And the thing about it is that it's not necessarily say you don't know how to be a nurse, but as I say, remember, at times you are just transitioning. You might be a new graduate, you know, you might be just a little bit slower than some other persons who are getting it correctly, but that doesn't mean that you don't get the same opportunity like other persons, or it doesn't mean that every time one something is supposed to be done, another person who has already done it a million times or more, you know, competent at it is always going to be the one to get it done. Because how is it that the other persons who are just learning will be able to do whatever it is that, you know, the task that they're wanting to get done? And so you find out that a lot of persons, you see, because of all of that favoritism, you realize that a lot of persons try to kind of push themselves outside of the department because they don't want to deal with it anymore. All right, but if you do have any other reasons why nurses are quitting their jobs, you know, go ahead and leave it in the comment down below. And if you're experiencing any of these, let me know which of them you think is more consistent with you working in your area. Just share, you know, share your insight on the topic. As I say, this is just some of the common reason I think some of the nurses are quitting their job, and it is, you know, it is just the reality, you know, it's just the reality of what is going on right now that we're dealing with. So until then, thank you so much for tuning in. Remember to hit the subscribe button, the like, the share, the comment, and leave your comment down below. All right, until then, I will see you in the next video. All right, bye.